everybody, this is Dr. Jones, CEO and owner of Colorado Medical Solutions. And if you're watching this video today, then you probably had a consultation in our clinic. Maybe you were there for natural hormone therapy, maybe you were there for stem cell therapy, or maybe you were actually there for functional health or functional medicine. Either way, you've been asked to watch this video because you have something going on, some underlying health issue that we need to address. Functional medicine is quite frankly the most powerful service that can be provided to patients to help them deal with systemic health issues that, in my opinion, get mismanaged in our broken healthcare system. We're going to talk a lot about that today, but in our healthcare system today, we get prescribed various medications to mask the symptoms and not address the underlying cause. And functional medicine is actually something that addresses the underlying causes and has the potential to give you back your life. So let's just go ahead and get into this. So how do you guys think our healthcare system is doing? Dramatic pause, because you probably feel like it's not doing great. I know I think the healthcare system is failing. Now, don't get me wrong. This is the country that if I ever, God forbid, get into a car accident or break my arm, I think the technological advancements of this country are phenomenal, and we do a dang good job when it comes to acute and trauma care. But that's where it stops. There's no prevention in this country. There's no preventative medicine. It doesn't exist. And I think that is the basis, that is the problem of healthcare. It's not fair to have to wait till you have a disease before a doctor even recognizes you, let alone then when he recognizes you, the only thing it provides to you is some sort of temporary solution, some prescription that has, in many cases, horrible side effects. That's not healthcare. So we probably remember this food pyramid growing up, and let me tell you, when I see this food pyramid, this is a recipe for diabetes if I've ever seen this. Hopefully, if you're watching this, you've kind of progressed beyond this, but sadly, I come across patients who still abide by this food pyramid because this is what has been the norm. This is what the nutritional so-called experts have been recommending, and it is a literal recipe for diabetes. We're going to talk a lot about today during this program, and a lot if you decide to move forward with us in a functional medicine program, what an actual diet should be. And please understand, it's not static. Depending on where you're at in your health, there is an ideal nutritional strategy for you, whether you have SIBO, whether you have a thyroid issue, whether you're looking for just overall optimization because you're not feeling as ideal as you'd like to. There's a type of nutrition protocol that needs to be prescribed for you given your physiology and where you're at. So let's talk health insurance companies right now. Gosh, look at Michael at Centerre or Joseph Points at Wellness Point. I mean, the guy's got $50,000 coming in per day. I mean, how does he survive, right? It's a shame that our healthcare model is a business, and it's so driven by profit, unfortunately, that this is part of the reason why there's no prevention, because there's no money for them when it comes to preventing disease. It doesn't happen. I better not catch any of you ever doing this, because this is horrible and this is a joke, although I know some people do it. God forbid you don't take your dog for a walk anymore, but the sad reality is we're getting lazy. And the buck stops here, folks. We have to take responsibility for our health, but it's confusing out there. And what functional health, functional medicine attempts to do is help you navigate through the difficulties out there that you would expect to get from your healthcare practitioners, because this is about your health, but you don't for the reasons that we've talked about. So prescription drugs cause over 128,000 deaths per year in America and over 200,000 deaths per year in Europe. No one talks about that. That's a lot of deaths, and nobody talks about it. It's just become the norm. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. That's the Medicare guidelines that just came out. They are literally saying, without any pause or hesitation, that if the treatment you're seeking for coverage has some sort of preventativeness to it, if it prevents disease in nature, it's not covered. It's not medically necessary, because saying that it's not medically necessary is saying that it's not covered by insurance. What the heck is that? That's a problem. This is why you shouldn't trust your health insurance companies to guide you in your health. 76% of visits to the doctor end in a prescription. CDC 2018. Center for Disease Control. A prescription, folks. This is what you're going to get in this broken healthcare system. An estimated total number of iatrogenic deaths that are induced inadvertently by a physician or surgeon, medical treatment, or diagnostic procedure actually trumps cancer, 780,000, compared to cancer, which is about 550,000 people that are going to die per year. That's our healthcare system, folks. So this is eye-opening, because we can't watch 10 minutes of television today nowadays without seeing several commercials. I freaking hate seeing commercials for drugs, but this is what we live in. And let's dissect this here for a second. Lipitor reduces heart attacks by 36%. Well, I want to have a 36% reduction in the chances of having a heart attack, so give me the Lipitor, right? Well, wrong. If you read between the lines, and literally you don't have to read between any lines, you just read the small print right there. The way they are able to get away with telling you there's a 36% reduction is they did a study. They had 1,600 people in the first group, and they had 1,600 people in the second group. Group A took Lipitor, and Group B took a placebo. This is a basic study comparing the effectiveness of a drug. Well, 3% of the people who were not taking Lipitor had a heart attack during the period of the study, versus 2% that were taking Lipitor didn't. So we're talking about a 1% difference. And they're able to get away with telling you because of the relative risk. The difference equates to 36% reduction of having a heart attack. And to me, does anybody here think that a 1% warrants the advertisements and the way they make this look? Does this look a little deceiving to you? Because it looks very deceiving to me. The New England Journal of Medicine, after 4 studies in 2010 involving more than 30,000 people, what they found out, this is a very reputable medical journal, the New England Journal of Medicine, medications did not reduce heart disease. See, they will reduce your blood pressure, they will reduce your cholesterol, they will reduce your blood sugar and your hemoglobin A1C. The drugs do what they are supposed to do as far as changing the markers on your labs, but the whole point of changing the markers on your labs was to reduce the chances of having a heart attack, from reducing the chances of having a stroke, of getting diabetes. Yet the medications didn't actually reduce heart disease. In fact, the study revealed that many devastating side effects included cardiac events. Statin drugs, which are probably one of the most profitable drugs for the pharmaceutical companies, cholesterol-lowering drugs. There was some research done by Dr. Bowden and Sinatra where they really dug into, and they wrote a book called the Cholesterol Myth. And it's very eye-opening for both patients and doctors. But research that they did showed that the cholesterol-lowering drugs might be the single worst class of drugs for your brain. Memory loss is now required to be listed as one of the side effects. So your brain is made up of a lot of fat and a lot of cholesterol. And so if you lower cholesterol, you are literally lowering the contents of what your brain is made out of. Not good. 1/4 of your brain is composed of cholesterol. It's necessary for memory, for learning, for fast thinking. Cholesterol is needed for your brain to make those neurotransmitters, which are basically chemical messengers that cause your brain to feel good, to feel great, to learn, to process memories, to experience life and all that it has to offer. Statins have been pushed on the public because they're among one of the most profitable class of drugs. 1 in 2 senior men and 1 out of 3 senior women are taking these drugs. And this is a problem because a lot of the newer research is showing is that higher cholesterol that we once thought, see, the reason why they push these statins is because, they're trying to reduce your risk of heart attack. But it's not high cholesterol that has anything to do with a heart attack anyway. This is what the newer research is starting to show. It's inflammation, it's metabolic syndrome, it's insulin resistance. That is the biggest contributor to developing the potential heart disease. So it all starts with our digestive process. It all starts here. You may have heard of the gut being called the second brain. It is becoming the centerpiece of our research when it comes to our understanding of the human body. You might already know that we have a lot of bacteria that coexist all over our body, but in our gut, you may not have known that we have about 10 trillion bacterial cells. About 5 to 10 pounds of bacteria make up our gut. You have more bacterial cells in your gut than you do cells in your own body. I want you to think about that for a second. We are more bacteria than we are a human being. That's how crucial bacteria are for our well-being, and we're finally starting to dig into it and understand this. So let's look at the digestive process. So it all begins with your mouth, and you are supposed to thoroughly chew your food. Chew it enough so that you get the mechanical breakdown in your mouth, and then you have various glands that release enzymes to break down the food in your mouth so that by the time you swallow the food and it gets into the stomach, which is the uppermost part of your digestive tract outside of your mouth, by the time it gets into your stomach, you have hydrochloric acid, which then breaks down the proteins. It churns it up. You have the muscles, the smooth muscles of the stomach that churn for about an hour or so and break down that food even more so that it passes through the stomach and makes its way into the duodenum and the small intestine, where you then have more digestive enzymes to break down the food even more so that it can pass through the wall of your digestive tract, which is like a hose, and then the food particles that are around the hose are broken down with more enzymes and they get absorbed by the body, and then it makes it into the large intestine where you have the majority of your bacteria, and you'll absorb more nutrition there as well, but mostly by the time you get to your large intestine and your colon, before you excrete fecal matter, is absorption of water and absorption of fiber. But that beneficial bacteria is responsible for producing 2/3 of our neurotransmitters. It produces a lot of our vitamin K and vitamin D, and it's extremely, extremely important for good health. So this is what normal digestion is supposed to look like. Let's talk about what probably most people are doing. You're in a rush, you're eating your food, you're not chewing your food thoroughly, so you don't get enough mechanical breakdown in the mouth, and the enzymes in your mouth don't have enough time to break it down. So by the time the food hits your stomach, it is a lot more undigested than what it should be, therefore stressing the glands in your stomach to produce increasing amounts of hydrochloric acid, which stress the stomach glands out even more, aka acid reflux, right? Which is the first problem that we see in digestion, is that your stomach doesn't have enough acid. So what do they do when you go to the doctor when you have acid reflux? They give you antacids. They give you neutralizing agents to calm the acid down, when the problem is your inability to break down the food to begin with. So we don't give them antacids, which make the problems progress in the long run. We give them more acid, believe it or not. We give them digestive support, digestive enzymes to enhance the body's ability to break down that food and then absorb it into the small intestine. So going back to the problem that most of us are experiencing with our digestive process is we get food passing the stomach into the small intestine, which aren't properly broken down, aren't properly digested, so they sit on the walls of the small intestine, aggravating the gut, aggravating the lining, causing inflammatory responses because we're not breaking down our food, we're not digesting it, so it's not being properly absorbed, and we're not getting the nutrition that we need. So there are various symptoms that should make you wonder, because you're most likely not gonna hear it from your traditional doctor, that the problem that you're experiencing, the abdominal pain, the diarrhea, the fever, the nausea, the malaise, which is that just kind of weakness and tiredness, it's probably stemming from your gut. 4 causes of leaky gut. So leaky gut is a condition, and I love the name because it literally is a leaky gut. So we talked about digestion, we talked about the small intestine where the most of your nutrition is absorbed. Your small intestine is like a hose, and the walls of the small intestine are where the food particles end up at, and the enzymes are released to break it down. Well, if you can imagine, these small holes here are what make up the spaces in your small intestine. And a healthy small intestine, so very small food particles can pass through. Well, when you have leaky gut, guess what? Look how big these holes get. So now you have bigger holes, which allow bigger undigested food particles to pass into your bloodstream. Well, we can't break that down. We're not supposed to get these large, undigested, broken down food particles into our bloodstream. So what does that do? Because the body's a genius machine that always handles to the best of its ability, is your body's immune system is triggered, and it flags those undigested food particles, and the immune system goes to work, and the immune system does what the immune system does. It breaks down and gets rid of those food particles. But now you have a pissed off immune system, right? And the immune system, depending on the person's genetic makeup and all these other factors, you find out that leaky gut ends up being one of the big contributing factors to all these different autoimmune diseases. And traditional medicine doesn't even recognize that the gut usually is the biggest contributor to all those various autoimmune diseases. Hashimotos is a big one. Fibromyalgia, all these different diseases where the body's attacking itself is the immune system attacking itself. And while it's very complex behind why the immune system is attacking a certain area, we do know that this leaky gut syndrome is partly contributing to how pissed off the immune system is to begin with. So if we heal the gut and we calm the gut down, we have gotten rid of one of the aggravators to that immune system. Food particles we talked about, gut infections. So our patients, when they have gut issues, IBS, for example, which is horribly mismanaged. IBS is not even irritable bowel syndrome. How many of you watching this video have gotten that diagnosis, by the way? And we're about to talk about what that really is. But a lot of times we test our patients, we do stool testing, and we find out they have yeast, they have parasites, they have different gut bugs, different infections. Toxic exposures are another big contributor to leaky gut. And then finally, stress, physical, mental, and emotional. All of these different conditions contribute to how leaky that gut can get. So, inflammation and leaky gut. So we talked about stress, we talked about toxins. I like this chart here because it just kind of gives you a better view. Remember we talked about the tube. Well, this picture here shows you what that wall of that tube looks like, and you can see that those food particles are passing through, and those holes are bigger because the gut's leaky. Leaky gut affects the whole body, right? And this is where we get into autoimmunity. The brain, the skin, the sinuses. We have so many different issues that happen because the immune system is now aggravated, and you have different areas of the body that were flagged to get attacked, and your immune system goes on the assault. So again, if we can heal the gut, if we can get rid of the toxins, if we can de-stress, if we can heal the gut, if we can get rid of the contributors to the leaky gut, we almost always see a profound increase in your health, whether you have a full-blown autoimmune disease or whether you just feel like crap. You will feel better if we can heal the gut. I can almost guarantee that. So what is SIBO? Small intestinal bacterial overgrowth. So SIBO is, it's getting a lot of recognition by the medical community. In fact, the majority of IBS diagnoses that you get from doctors is actually SIBO, but they don't test for SIBO. A lot of doctors don't even know what SIBO is. So what is SIBO? So we mentioned that you have bacteria in your large intestine. So you got the mouth, the stomach, the small intestine, large intestine, and then the colon. That's where you excrete fecal matter. The large intestine is where the majority of that bacteria exist. You're supposed to have a ton of bacteria there. Small intestinal bacterial overgrowth, just like the name sounds, is where that good bacteria makes its way up your digestive tract into the small intestine. And so now you have what was good bacteria in the large intestine. It's not good bacteria in your small intestine. It wreaks havoc and it causes all sorts of issues. It causes more inflammation. It causes vitamin and mineral deficiencies because now those once good bacteria are wreaking havoc in the area where you're supposed to be digesting, and they interfere with that. They eat up the nutrition and the nutrients from the food that you're eating. It can contribute to anemias. It can contribute to kidney stones, osteoporosis. There's a whole host of complications that can arise in the condition SIBO. The 10 most common symptoms are, the number one is bloating and gas. So if you're watching this video and the number one symptom is when I eat, I bloat, period. When I eat, and it's specifically, it could be when I eat anything, but specifically, if we want to get more technical, when I eat fiber or when I eat carbohydrates, I bloat. Chances are, with a high degree, is that you have small intestinal bacterial overgrowth. It's not just bloating after you eat, but that is the hallmark key. So please tell us that if you haven't already. But you have issues and symptoms like anxiety, abdominal pain, constipation, diarrhea, food intolerances. And again, we look at that diagnosis, irritable bowel syndrome. 80% of people that have IBS actually have SIBO, and this is why. So this chart just kind of nicely lays out why so many people who are given the diagnosis of IBS actually have SIBO or SIFO, small intestinal fungal overgrowth, which is the same thing. It's fungus where it shouldn't be. SIBO can cause issues with digestive enzymes, stomach acid. It can lead to constipation, a whole host of issues nutritionally are going to be compromised by SIBO, which is why SIBO is one of the first things that we target in almost any issue that a patient has symptom-wise. Like, for example, if a patient comes into our clinic and they want to get on testosterone, this man wants to get on testosterone. If I think he has SIBO, I'm not letting him get on testosterone. I'm gonna check for SIBO first, because we got to get that fixed. So a lot of you might be wanting to lose weight. It might not be the reason why you're in our clinic. It might not be the thing that you are asking for help, but in the back of our mind, you might want to lose weight. And with functional medicine, we're not just here to target that one issue. We are getting to the underlying cause of why your body develops issues to begin with. So when we address the SIBO, when we address the leaky gut, your entire body gets better. Therefore, if you had an issue with losing weight, all of a sudden that becomes easier too as well. We balance your blood sugars. We balance your hormones like cortisol, testosterone, progesterone, and estrogen. And we help the body detox all the common things that can interfere with the body's ability to lose weight. So some common inflammatory symptoms are depression, nervousness, emotional swings and issues, highs and lows, headaches. There are over 100 autoimmune diseases, and I feel like they are just poorly managed in our current broken healthcare system. Generally speaking, they give you powerful steroids, powerful different types of steroids and corticosteroids, which will give you some pain relief, but they almost always have to end up giving you on stronger and stronger steroids, which end up destroying the body long term. And again, they're negating the issue. It might be something as simple as leaky gut or small intestinal bacterial overgrowth. Now, I'm not promising complete resolution of your autoimmune diseases, because remember when I said earlier, it's a very complex disease. I think there's genetics to it. It runs in families. But almost always, I've never seen somebody with an autoimmune disease not have a leaky gut, or not have SIBO, not have some sort of gut dysbiosis, which is a fancy way of saying an imbalance between the good stuff and the bad stuff in your digestive tract. Okay, so this is very important to understand. This is functional medicine in a nutshell. So most doctors are looking at your blood work, and we're checking various markers. And we have a reference range on the blood work that tells the doctor if the patient's above this or below this, they got a problem, i.e. they got a disease. But the problem with that is that reference range in many cases is very far from optimal. It's very far from ideal health. I'll give you an example. When it comes to min and testosterone, it says that the reference range says that anywhere from 250 to 950 LabCorp's recent update, and you're perfectly okay. Yet we know as a hormone clinic that men feel like crap when they're usually feel like crap when they're at 300 or 400. Men are optimal when they're in 800 to 900 to 1,000, sometimes even more. So it's a much narrow window. That's the green zone. That's the ideal. That's the optimal health. Yet in the current healthcare system, you don't even get recognized that there's a problem until you fall outside the lab ranges, which at that point it's already progressed into a disease. So do you want to wait to do something about your health until it's a disease and be given a bunch of drugs? Meanwhile, you continue to live the same lifestyle that's been contributing to this issue to begin with? Or do you want to work with a clinic that's actually going to help you regain your health? That's going to help you not be lazy, because they're going to tell you the truth. They're going to tell you that if you don't change your diet, if you don't change your exercise habits, if you don't change your mindset, you're not going to get your health back, even with functional medicine. But if you are willing to make those commitments, we're going to help you get there. That I can promise. 90% of the thyroid symptoms among US women are due to autoimmune disorders. Hashimotos and Graves are not thyroid problems, but the current healthcare model will put you on thyroid meds for the rest of your life. They might get rid of your thyroid gland too as well. That's horrible. We've had so many patients that were down that path make a dramatic change and no longer have to be on the thyroid meds because we address the underlying issues behind that Hashimoto's to begin with. Cold hands and feet. Tiredness and sluggishness. I love that picture, by the way. Hair loss and thinning. And coarse constipation. These are some of the hallmark signs of a sluggish thyroid gland. We can pretty much look at your body type and get a good idea of some of the potential hormone imbalances. We can see when you have adrenal issues, how you're going to store a lot of body fat over the stomach. If you have issues with your ovaries, you might be like excessive estrogen, for example, estrogen dominance. You might put more weight around the hips, buttocks. If you have thyroid issues, you just kind of gain weight everywhere. And men get this issue with their liver, where they're lean, they're not overweight, their body fat's not high, but they got this big gut. And that fat storage is the worst because the abdominal fat produces a lot more inflammatory cytokines, basically a lot more inflammation than fat elsewhere in the body. Hormonal issues that you might be experiencing, mood swings. So how do we fix this, folks? What do we do? We eliminate the leaky gut, we correct the inflammation, we address nutritional deficiencies, we restore that gut dysbiosis, we take care of the infections, we identify the hormone imbalances. It's not an easy process. It's a process. There's a lot to do. But isn't your health worth it? Okay. So we kind of look at this whole this health. We look at it as pillars. We have the digestive component, we have the nutritional component, the hormones, the exercise, and brain health. That's the easiest way to compartmentalize this into 5 areas. So how many of you are ready for a new approach to health? I know you're contemplating it, or else you wouldn't still be watching this. Treatment, testing, and teaching. Systematic and step-by-step. I won't give you a lot of homework, so don't worry. I'm going to give you some because my goal is to change your life, change your habits. I'm not just looking for a temporary solution. See, currently, right now, you're a wilted plant, a plant that's wilting. It is dying. And the current healthcare model wants to paint those wilted leaves green. I'm not here to do that. I'm not here to paint the wilted leaves green. I'm here to figure out why the plant is wilting to begin with and address those issues. How would life be if you were able to turn your brain on again? Not have to reach for that second, third, fourth cup of coffee. Not walk around like this cloud of fog is over your head. Wouldn't that be something? Aren't you tired of going to your doctors and being told everything is fine when you know damn well it's not? Something is wrong. You're not ideal. Yet you've been trained by your doctors to say everything's fine. But it's not. That feeling inside that you have, you're right. Something is wrong. On a scale of 1 through 10, how motivated are you to really do something about it? Tell me and I may remember, show me and I will remember, involve me and I will understand. I love that, because that's what we're all about at Colorado Medical Solutions. So you have two choices at this point. You could say, great information, I'm going to go back to living the lifestyle that I was living. Maybe we won't see you again. Or maybe this is it. Maybe this is that sign that you were looking for. Maybe this was this wake-up call to you. Because I love doing that for people. I love providing them the opportunity to make a lifestyle change. Okay, folks, I hope that you found this very educational and inspirational too as well. You might be wondering, well, what the heck is it that you're going to do? Why is this so powerful? Because it is. As complex as functional medicine is, it's actually pretty simple to understand. We're going to take a deep dive into discovering what is wrong with your body, right? Do you have a yeast overgrowth? Do you have small intestinal bacterial overgrowth? Do you have leaky gut? Do you have an autoimmune disease? What do you have that the medical doctors may or may not have been able to diagnose? And we do this through comprehensive blood analysis, salivary analysis of specific hormones, and a stool assessment. This comprehensive set of tests allows us to maybe, because we don't know for sure, diagnose what is going on and then set you on a proper plan from there. That plan from there is going to involve 3 components. It's going to be a specific supplement plan, because it's going to be different depending on what we find you have or what we think at that point you may have. A specific supplement plan. Then we're going to put you on a specific nutritional protocol that's tailored to the disease or the disease process that's developing that we find. And then a proper exercise program based off of where your health is at. Once we figure all that out and we put that plan together, then we go to work, where you're going to work with a health coach who's going to help you to implement that nutrition, implement that supplement plan, implement everything that we need in order for you to get the progress based off of what we think we're working with. Then about somewhere between 3 to 6 months later, we have to stop and take another set of blood tests, salivary tests, and stool tests. And in most cases, we're going to see dramatic improvement. And unfortunately, sometimes we don't see dramatic improvement. But this is crucial because it confirms our diagnosis or unconfirms and maybe sets us down another path. But in most cases, it confirms our diagnosis and we tweak a few things here. We might change the supplements. We might add some new ones in. We might take some ones out. We're going to upgrade this. We're going to change this. And then boom, you're in the second phase, working with the health coach to get to that point where we can then, maybe another 4 to 6 months later, test you again. And by that point, after a year, most people are completed. Most people, we've accomplished correcting these imbalances and regaining your health back. Some people, we can pull it off in 6. It depends on how complex your case is. And depending on the complexity, I won't even take you for less than a year because I don't want to waste your time and money. So please, stop procrastinating and take that next step towards your health. Better health. Now, the way this works is if you're ready to move forward with the program, please give us a call. Let me know, and we can go over what we recommend and what the finances look like for that program. If you're not sure yet, but you want a little bit more proof, which I get it. If you want to spend a little extra money, it's $3.99. And what that does is that lets us take a comprehensive blood test so that I can show you all the different things that are wrong, all the disease processes that aren't a disease yet, which is why your medical doctor hasn't told you anything yet, why it's not outside the reference range, but how it's deviated from the optimal, if you guys can remember that one slide we went over, and how the diabetes is on its way, how the thyroid issue is on its way, how the inflammation is growing. And maybe at that point, seeing in front of you the issues that are developing, then you might be ready to finally do something. The choice is up to you, whether you want to go for the blood panel and spend the extra $3.99 or whether you want to get the blood panel free as part of the program because you decide to move forward with it. Either way, give us a call at this number, get scheduled. Maybe you already have an appointment with us and we'll see you when you guys get in, okay?